Hello, everyone. This is Kendra Mickens, and I'm doing an assignment for a policy platform activity. And tonight I'm actually going to be discussing support for House Bill H589 here in North Carolina. It's actually a bill that was introduced by House Representative Beverly Earl. And when we look at this House bill that has been proposed, it is House Bill again, H589 LRC, reevaluate immunization requirements. What she's looking to do and what she's proposing here in North Carolina is that we actually look at this particular time, should we add or delete any of the immunizations that are presently on the schedule for childhood immunizations. Also, she proposes that we reevaluate acceptance of or need to repeal exemptions from vaccinations, again, here in North Carolina. One of the things that should garner quick support for looking at vaccinations here in North Carolina is that when we look at costs and the costs that would be incurred by our state, one of the things that we don't really have to focus on is that cost factor. When we look at programs like the VFC, which has been around for 20 years now, 20 years plus, it was started in 1994. The VFC is actually a federally funded program that looks to get vaccinations to children who qualify for Medicaid. It also looks to get vaccinations for children who are underinsured here in these United States. When you look at it, different providers, pediatricians can look to actually become members and participate in the program. And then, as we already know, when we look at the big push for preventative health, which we know overall in the long term actually saves money, not just for insurance companies, but the burdens, again, when we look at state supported programs, again, it saves money to support preventative health. So when we look at these programs, even if a person has insurance and say that they have a vaccine for their child that's not covered, again, these federally funded programs such as the VFC can then step in, and that person, although they have insurance, if that vaccine isn't covered, can then take their child to the local health department. And typically they can get the vaccine for their child, and this is what your constituents would like as well, at no cost. When we look at this VFC program, which is the Vaccines for Children's program, it typically is at no cost for those who participate. When you go to the cdc.gov's website that talks about vaccines and talks about the VFC program, what it'll let you know is that this saves this country, and get ready for this, $1.4 trillion. I repeat, $1.4 trillion by just having this vaccine program. And then when we look at the lives that are being saved, 732,000 prevented death. When we look at illnesses, 322 million illnesses are said to be prevented when you go to the cdc.gov's website, just from this program alone. When we look at this, let's think about the time that children miss from school. When we think about the time that parents miss from work, being able to be productive here in this state. Again, programs like this help save us. So again, for North Carolina, as we look at this bill that is just proposing that we just look, again, just look to see, do we have every vaccine that we need to have on our immunization schedule at this time? Also, again, when we look at our exemptions, presently we are a state that accepts both medical and religious exemptions. Again, this bill is proposing that we just take a chance and take this time out right now to look at, should we keep everything as it is, or should we look at changing it? Again, you just heard, by just having a program that doesn't even cost our state anything. Again, federally funded program. And again, your constituents, typically our taxpayers, are being able to participate in this program, typically at no cost. What do we lose in looking at promoting a bill such as this? So even when you look at different places, such as the www.northcarolinahealthnews.org, North Carolina, we're not the only state evaluating this. We're not the only state taking a time out right now to pause and say, do our childhood immunization schedule cover our children the way we need them to? When we look at this article from August from the North Carolina Healthnews.org website, it actually brings us back to that 2014 measles outbreak in California at Disneyland. In that one outbreak alone, they found that at least 50 of the people involved in that outbreak had not been vaccinated. And when we look at the impact of that one measles outbreak in California at Disneyland, it turns out that it affected 147 people across 7 different states. And again, 50 or more of those people had not been vaccinated. So again, I say here in North Carolina, we do allow religious exemptions, but every state does not. When we look at states like West Virginia, Mississippi, and now California, they now only allow exemptions from vaccinations for medical reasons. So North Carolina, should we be the 4th state to join them? We could protect our state. We could protect our visitors. We have wonderful locations here, and we want people to feel safe when they come and visit North Carolina. Is this something we should take the time out to see? Should we stop accepting religious exemptions? This bill proposes that we at least ask ourselves that question, and should we join them? What I'm going to leave you with is actually a quote from North Carolina Institute of Medicine, Healthy North Carolina 2020, A Better State of Health. Quote unquote, vaccines are described as one of the 10 great public health achievements of the 20th century. For every dollar spent on the U.S. childhood immunization program, $5 in direct costs and $11 in additional costs to society are saved. I implore you, North Carolina, we cannot afford to ignore this bill. Thank you.